All right, Penelope, congratulations so much for passing the NCLEX. Yay! I know you're so excited. It's been a journey for you. And so I'm so honored that you took a chance on me to help you prepare for the NCLEX, and it paid off. Now you have passed the NCLEX and you're just waiting to get that license processed for the state that you're in. So just take a couple minutes and, share as much as you like about your NCLEX journey. Like, what has the journey been like for you, and what led you to find me for assistance?
Yeah, so my journey has actually been quite long, as you know. I took my first test in 2012 and I didn't pass, but I kind of left it behind for a little bit and worked as a nurse in Denmark for 6 years. And then I kind of moved to the States again. I didn't expect that, and had to take the NCLEX again. And right away I knew that I needed help. And I have a couple of nursing friends that tried your program. Maria is one of them that I can highly recommend. She's been a great support. And yeah, so I knew right away that I was going to use that program. So after I finally got through all of the little hoops that took around 2.5 years, I started your program, and it was immediately a lot easier for me to kind of understand what the NCLEX was about.
Awesome. So first of all, shout out to Maria, right? Maria was my first Danish client many years ago now, who took a chance and reached out to me after she saw some things that I had posted online. And since then, I've had many Danish clients come through now who I've helped out, which has been really great. I'm glad that, I've been able to kind of step a little bit into the Danish nurses group that you guys have on Facebook. I'm so very happy for Maria giving the recommendation, the testimonials and the things like that. It's been super helpful for many people now, like yourself. If there was one thing you would say is majorly different between nursing in Denmark and how you have to think about it and stuff like that versus here, what would that be?
I think for me, like taking the NCLEX was the biggest difference from the step from being a student nurse and then to be registered.
Yeah.
We do it a little bit differently. I don't know how it is to work over here yet, so I can't answer that question. But for schooling in general, I think the testing is very, very different. We don't have as many tests, and we don't have the multiple choice test as much as you have over here, which requires a different way of thinking. And that was the hurdle for me. Not only that, the verbiage of the questions were a little bit difficult for me to understand. Yeah, so I think from being a student nurse to being a registered nurse, the test is for me, the biggest challenge and the biggest difference.
Yeah, I mean, one thing that the NCLEX does that and I work with lots of international nurses from all over, one of the biggest differences between passing the NCLEX to get your license versus some of the other country tests for certification or licensure is that the NCLEX focuses a lot more on conceptual nursing, the critical thinking component, the what if, right? This is what you're presented with, now what are you gonna do? Whereas other countries, the doctors typically have that responsibility of deciding what to do next, what's best based on the clinical presentation, what should be done, so on and so forth.
Yeah.
But here in the United States, as you've learned, part of our judicial system, the way that we process professionals with a license, right, to practice, whether it's law, medicine, nursing, engineering, whatever the case may be, anyone who receives some kind of professional certification or licensure is held to a very high standard to make sure that we are always working within the guidelines of that licensure. And in a lot of other countries, it's not quite the same. Doctors take on a lot more of that responsibility, whereas the nurses focus more on the delivery of the care tasks, right? Giving the meds, doing the treatments, giving the education for discharge, things like that, but not more of the big picture decision-making, double checking, triple checking that the diagnostics and the meds and everything makes sense because we are protecting the patients at a very high level, and we're also protecting ourselves, right? We are CYA, right? And CYA means cover your ass, right? We have to make sure that the things we're doing make sense, that it meets the standards of care, that we are making decisions based on evidence and what we know to be true, and we are always following textbook nursing when we make those decisions. Now, of course, you've also learned to discern the difference between preference versus what we're required to do, right?
Mm-hmm.
In many places, if a resident or a patient says, no, I don't want it, you just simply say, okay, no problem, you don't want it. I'm here to help you, but if you don't want it, no problem. But there's layers to that, right? We can't just simply say, oh, okay, your choice, you have a right, so I'm gonna walk away now. In fact, our judicial system is so strict that if we, someone of knowledge, do not impart that knowledge onto our residents or family members or patients to inform them of the risks and benefits of refusing treatment, then that could be deemed as neglectful, right?
Yeah.
And so we as nurses want to be the best advocate we could be for our patients. So we don't want to be neglectful.
No.
And so the NCLEX tries to create a lot of different scenarios to challenge all of these different levels and layers of nursing that go beyond just medications, diseases, diagnostics, and wound care, right? It's more about managing patient care. It's more about understanding the nuances and how to communicate, how to delegate, how to prioritize, which nursing school doesn't always do a great job of teaching just because of the limit of the school itself. We're in school for this much time compared to how much we need to know about a person and how to make decisions on their behalf, right? So with all of that being said, would you say that my program was able to kind of clarify a lot of that for you regarding the roles and responsibilities of the nurse, and then fill in the gaps of some of the knowledge deficit that you may have had?
Yes, I most definitely already after the first couple of videos and when I read through the text and listening, I already understood a lot more. It was like those little bricks to the puzzle, or how you say it, that was kind of falling into place one after one. The way it was built up was very intelligently made, I think. So it didn't take me very long from like starting to kind of slowly understand what the NCLEX was about, but also in general what nursing over here is and what the difference is between the countries, and what I really had to put more awareness and attention into. So it was hard, but it was still like, it was easy for me to follow the program and get guided in the way. I chose the big package, so also had the benefits of the coaching, and that made it even easier.
Right, perfect. So, easy to understand, first of all, right? Written in a way that it's easy to understand. Would you agree?
Yeah.
Great. Did it sound like you were reading from a textbook, or did it sound more like I was speaking with you?
Combined with the videos and like the audio, because I am learning many different ways. I have a hard time reading. It was not just a textbook. It was really good for me in general to have all the options.
Good. Right.
No, it didn't feel like a textbook.
Good. So, I work really hard with making sure there's different ways of learning. I have visual guides. I have text, a lot of text, videos, voice clips, and then of course a resource library that includes all kinds of web-based resources or resources that I've created to kind of just put it all together and give you some more information if you need to brush up on some content related things, right? So I know you spent some time in the resource section to kind of fill in some of the gaps for some of the stuff that you haven't looked at in a long time, right? Since 2012, that you really haven't paid attention to because you haven't been trying to take the NCLEX for that time. But you would say that resources library helped you to fill in some of the content gaps. Would you agree with that?
Yeah, I actually watched quite a bit of the videos, and I got sidetracked sometimes because then there was another video and I was like, oh, I'll just watch this one too. And the videos were very good at explaining all of the things into detail, so it was understandable. So I was like, again, little pieces fell into place, and I was like, oh, that's what they want. Oh, okay, that's how I have to think. So it's a lot easier for me.
Perfect. Perfect. And then, so you've already said you would recommend the program. So thank you so much for that. And then if there was one thing that you would do differently from, not passing the last time all the way through till now, and seeking out my services, what would you do differently? If there was one thing you would do differently?
So at that point, your program was not provided, so I can't pick that option.
It was not in 2012, so you're right. I didn't
No.
start in 2016, so you're right there.
So if there would have been, like, I took a Kaplan program at that point, which didn't help me because I didn't pass. I don't know, because I think this is what I needed to pass. So, and at that point, it just wasn't in my story to take the NCLEX again. But if the program would have been available at that time, I would have taken it, but it wasn't. So.
Well, thank you. So, I mean, honestly, whether it's my program, whether it's someone else's program, I think the most important thing that everyone should take from this is just get started, right? Pick a time. When is a time good for you? And anyone who's not sure of when that time is good for them, as you know, I offer free consultation calls. We can hash it out, talk a little bit about where you are in the journey, so I can let you know, do I think that my program is appropriate for you right now, or should you wait and handle some more personal things? Like maybe your life is a little bit messy and you're not really ready to dedicate time to prepare for the NCLEX, because it's not an easy feat. Like you said, it's not just like you can read a few things and you have it. It does take time. It takes anywhere from, depending on how fast you learn and how fast you get through all of the lessons, the post-test, the assignments I have created, the scheduled tutoring, check-in calls, all of the things that I have built into the program to just really put it all together for you. It could take a week or more, right, to complete all of that. So we're talking 40 plus hours that it could take you to get everything you need. But imagine in 1 week, 2 weeks, a month even, you have everything you need to pass the NCLEX versus however long it's taken you with that voice in the back of your head of, oh, I'm not sure what's gonna help me. I don't know where to start. I don't know what I'm doing wrong. Am I even smart enough to pass? Why can my, classmates pass, but I can't? What am I missing, right? So no one can answer those questions alone, right? We need help. We need someone who's an expert, someone who's been there and who has helped over 9,000 people, mind you, that have helped pass the NCLEX now over the years. So, just take the initiative and get started. And I'm so glad that Maria had recommended my program. You probably found her through the Facebook group, is that correct?
I think.
How did you get in touch with Maria? How did you connect?
It was probably Facebook, and we started talking and we've become friends. So
perfect.
Yes, it's been a really great support in general.
Great. And she was a client of mine. I've also helped her to position herself to be continued help for other Danish nurses who want to get their US license. So she's even created a service that helps people navigate all the complexities of getting started with the states, right? That's not my specialty. My specialty is not navigating the state documentation, the immigration paperwork, the transferring of, transcripts, getting those approved, all of the English proficiency tests. None of that is my specialty. So I humbly, give that over to other people who are experts. It's okay. I humbly give that over to people who are experts. And I think Maria is building herself up to be one of those experts. So any Danish nurses interested in US licensure, we can certainly make sure that the Facebook group link is in the bottom of this tutorial, and I'll put it on my YouTube channel. So that way people can link to that Facebook group. I'm sure it's a join request option. It's not public, I don't know. But either way, I'll put the link in there. So you can always link in and start chatting and see how you can get additional help. So awesome. So Penelope, again, congratulations. You are
Thank
now
you.
ready to get that RN license. Just waiting for a few things to finish with the state. Sometimes the states can be annoying. They want extra documentation. In Maryland, when I was waiting for my license to process, I graduated in May. It took me till August to get it because the lady who presses approved was out on leave of absence.
Yeah.
Imagine a whole state has one person that presses approve once all of the paperwork comes through. It's interesting how we do things here, but it is what it is. So sometimes it takes a while, but passing the NCLEX is the hardest part. Now you're done. So
Yeah.
Congratulations again. I look forward to following you as you go through your career, and just remember you always have me as a resource for you. So
thank you.
Always and forever.
All
right, Penelope. All right, thanks again. Congratulations. I look forward to talking to you soon. Take care. Bye.
Thank you. Oh my God.